When you're ready to perform your first test, take the lancet and insert this into the lancing device. We've already done that with a lancet, and remove the cover so that the sharp lance is showing. Replace the cover and ensure that the lancing device is ready to trigger. The release is this button here. Just by a single push it releases the lance. It can be re-triggered. That is ready to use now. Have the little transfer pipette ready. This will suck up the exact correct amount of blood to trigger this meter correctly. And you don't have to squeeze the bulb for it to do so. You just place it into the droplet of blood that is formed. The next stage is critical in getting an accurate result. Go and wash your hands thoroughly in warm water for between 1 and 2 minutes. Give them a really good warm perfusion. Well, in this section we're going to show you how to prepare the meter to perform your first test. With the batteries in situ, insert the code chip, which is supplied with the test strips that come with the meter, into the top port. Then power on the meter. You'll see all the display come to life, and then it will start flashing at you. Now, the reading on here, 0.002, should correspond with the code number on the side of the test strips that you are about to perform your test with. If they do not, then the code chip is not the correct code for these test strips, and you should replace it with the correct code chip for the test strips you're about to perform the test on. Now, the other thing you'll see flashing in here is the number of the test you're about to perform, but also PLA. Now, PLA refers to the sample. You are, if you're doing a capillary sample, not going to use plasma or serum. To correct this, hold the left-hand button down, and you should come to a screen that says sample. Now, that's showing plasma. We want to move that to blood. The options are blood, serum, or plasma can be tested. If you are doing capillary sampling, ensure that the meter is set up to read BLO for blood. Once that's correct, you can press the power button and it should start flashing BLO for the sample. You can then insert the test device into the meter, take one out of the pot, close the lid immediately. The correct way up for the test devices is the single port upwards, with the 3 ports showing down, which will correspond with the LED ports on the meter. This is inserted into the meter, and when you do so, the meter will recognize a valid test strip that's not being used, and the flashing blood droplet indicator will show there, indicating that the meter and device is ready to accept the sample. In the next section, we will show you the technique for getting a good sample for accurate readings with this meter. When you have washed and dried your hands thoroughly, they should be pink and well perfused. If they don't look as if they've got good blood supply peripherally, then go and wash your hands and warm them up further. Then massage your fingers to again increase the capillary flushing peripherally. Take your lancing auto lancer, place it on the pulp of the end of the finger slightly towards the side. Firm action, release the lance, and you should start to get some blood formed. Wipe the first droplet away quickly and then allow the second droplet to form. You can, with this device, slightly massage the finger to try and get a good blood flow. Then take the transfer pipette and feed it on an angle into the blood droplet. This should then start to feed blood up into the transfer pipette. On a sideways motion is usually best, on quite an angle, so that the blood is sucked by the capillary action into the transfer tube. You'll see it flowing up through that flattened section. You want it to get to the end of that flattened section before introducing it into the test device. If you try too early or it doesn't flow right to the end of that flattened section, you will get an E5 inadequate sample or insufficient sample readout. So just keep pushing that through the blood sample until it's right the way to the end of that flattened section. There we go. I've got sufficient sample there now. So I'm going to put this transfer pipette over the sample well and squeeze the bowl very gently to dispatch all 35 mils of the blood sample. There we go. Make sure every last drop goes in. And the meter should now start to interpret and read that blood sample. It takes around 120 seconds, 2 minutes. So we're going to come back and show you this cholesterol result once the meter has done its full analysis. When the reading is complete, the meter will beep at you and then start displaying the readings. So here we go. My cholesterol is 2.59, HDL 0.39, triglycerides 0.65, and the ratio 1.69. So those are your 5 readings. It will circulate throughout them, and these will be stored in the memory, so you can come back and look at these readings at any time. The key element to getting this meter to trigger and give you accurate results is a good lancing technique and a good transfer technique using that transfer pipette. You must not try and put inadequate or sufficient samples in. You will simply waste the test device. If you're having problems with your capillary perfusion and your lancing technique, please contact our customer service team for support and some guiding tips. But the key we find is always washing your hands in warm soapy water and drying them thoroughly for a good couple of minutes to really get the capillary perfusion good and the blood droplet to form naturally each time. If you can do that, then you'll get incredibly accurate capillary readings for these 5 cholesterol parameters using this device. Thanks for watching.